Hello, Dr. Shah. Good to finally meet you.
Thanks, Krunal. Pleased to meet you.
How was the drive in?
Driving was okay. I'm familiar with this area, and navigation in the car helped me to come straight to your building. Also, I noticed there's plenty of car park, so it was easy to find a car space. So it was good here.
That's good to hear.
Mm.
Now, before we begin our session, I just need to cover confidentiality.
Mhm.
So, whatever you say in our sessions will be held confidential by me.
Mhm.
However, in the case of you being at risk of harming yourself or harming someone else, I'll need to break confidentiality. Does that make sense?
Yeah, it's okay. I understand.
Now, I have a confidentiality agreement which pretty much says what I've just explained. I'd like you to have a read through it, and then we both need to sign it. So I've got it here with me.
Okay, thank you.
You good?
Thank you.
All right. Thanks for that.
Yeah.
So now, have you been to see a therapist before?
No, I haven't been. This is my first time to see therapist for myself. Yeah.
Mm-hmm. And how does that sort of make you feel coming for the first time?
Yeah, a little bit nervousness, little bit of feeling, anxiety, but it's okay, It's all right.
Okay. So it can be quite normal to experience some anxiety when you come and see a therapist for the first time. And that anxiety usually disappears and goes away with time. We can also unpack and try to understand what that anxiety means for you as we move further into our sessions. So, what brings you in today?
Krunal, last 2 years I've been working in ICU. Um, long working hours, not able to recover from long working hours, causing physical and mental exhaustion. Not able to spend time with the family. Constant exposure to COVID environment makes you bit anxiety. Creates anxiety that you will catch COVID and you will take home. Staff problems, at times problems of shortage of ICU beds and other resources. Makes you you feel upset and helpless. Um, Also, you feel a bit burnt out because of the constant pressure at work, and all of those things. I thought that the best thing is to take a professional help and get some kind of help so that I can go through some therapy or some kind of a counseling which can bring back bit of my positiveness and eliminate any negativity or like that.
So, these issues that you've been facing, how have they made you feel?
It has made me feel a bit low on energy, both physically and mentally. Also, a bit of a mood point of view, it is a bit. At times, I've become different moods, sort of feelings I get it. Also worried about my own safety and safety of the family. Yeah. So that's what it is.
So, when you say different mood, what does that sort of
You basically, all of this thing has created a bit of you can say mental trauma, which creates your mood of, either withdrawing from things and kind of not having enough energy to take part in things, which makes you feel further guilty that you are not able to do things actively with your family, and all of those things makes you feel different mood cycles you go through.
Okay. So, how long have you been having these feelings?
Basically, slowly started about 6 to 9 months ago, and slowly it's building up. But it has come to a point where I really feel that I'm burnt out.
And when do you have these feelings?
During the day it's okay because with the work you know go through the work and your mind is busy.
Hmm.
But it is more coming up at night when I go to bed or just before the sleeping time it starts coming in my mind.
Hmm. Okay, so if I sort of had to summarize what's been going on, working really long hours, it's burning you out physically and mentally. You're not able to spend time with your family. Um, you know, you feel kind of helpless having to work during the pandemic, seeing the patients come in, not knowing sometimes how to help them, and that's all making you. It's affecting your mood. Um, you're feeling afraid and worried of catching COVID, and you feel like there's this mental trauma that you've sort of gone through. Does that sort of make sense?
Yeah, I think you summarized very well.
Mm-hmm. Okay. So it can be quite overwhelming to address everything at once. So what I'd like you to do is to pick something that you'd like to start working with first.
My first priority would be to recover from this mood changes
Mm-hmm.
and regain bit of a positiveness. That's my main priority.
Okay. All right. So we'll begin with the mood changes and exploring that. So great. It's great that you've come up with a priority. And I guess I just wanted to pause and just appreciate how difficult it has been for you during this time. And you've shown a lot of courage in coming here today and sharing your story. I have a few friends who are doctors and they've been telling me how hard things are. So yeah, I can appreciate your situation. And you did really well to articulate your feelings. Yeah. So I know you said that you haven't seen a therapist before, but what are you sort of expecting from our time together?
Yeah, basically understand what is understand what the issues are, and then from there understand from your experience and background what I should do, what some kind of a therapy or some kind of a thing I need to practice to recover, and so basically get a professional help and then put something in place
Mm-hmm.
which helps me to recover quicker
Okay.
rather than struggling on my own.
Yeah. Okay. So that totally makes sense. And it's great that you come here today. So I guess when it comes to therapy, people have this misconception that the therapist is the expert and provides all the advice and the solutions. However, therapy is a collaborative process. We'll be working together. And what you'll find is that I'm there to guide you towards finding the answers and the solutions yourself through our time together. So that's sort of how the therapeutic process works. Also, what you'll find is that as we go, I'll be drawing from different therapies, such as rational emotive behavior therapy, gestalt therapy, and we'll sort of use those therapeutic concepts and, I guess, practices in the work that we do together. And I'll explain some of those terms as we go. Now, did you get the starter pack?
Yeah, I did receive a starter pack with the email which I received from your secretary.
Yeah. Okay. So, do you have any questions about it?
No, I think it's okay, but I wouldn't mind you summarizing some key aspects of it, so it helps me, reinforce those points.
So, our sessions are 55 minutes. It's $175 per session. We have a 24-hour cancellation policy, so if you cancel last minute, then you'll have to pay half of the session fee. Our sessions will always run here. I'm located at this counselling centre. Now, I think we'll begin with once a week. Is that okay for you?
It's fine.
Yep. And the last thing that's left to do is pick a day and a time, and then we can sort of meet next week. So what day and time works for you?
I think Friday afternoon would be better for me.
Okay, alright, so I'll get the receptionist to book you in for Friday 3:30 then.
It's okay. That's fine.
Okay, perfect. Well, I look forward to seeing you then.
Thank you very much. Same here.
Okay.
Thanks a lot.